Good evening everyone, and I thank Lyco team for inviting to this webinar. So I'm going to discuss about investigating sudden loss of vision in primary eye care. So in the given 10 minutes time, I made a small presentation. I will go through that. So these are the three learning objectives from this presentation. You will understand what is sudden loss of vision, what are the conditions can cause sudden loss of vision, and how to investigate them in the primary eye care level. So first, let us try to understand sudden loss of vision. So the sudden loss of vision can occur over a period of few seconds or a minute's time, and sometimes it is in few days of time. So it happens in a short period. So when sudden vision loss happens, patient may notice either blur vision or cloudy vision. Sometimes some kind of curtain appearance in front of the eye or in the visual system. Sometimes patient may notice the vision is lost completely. So this vision loss could be part of the field of vision, or sometimes the entire visual field could be affected. So this sudden vision loss most oftenly painless, but in some conditions it is associated with pain, redness and headache. So if any sudden vision loss, we should consider it as a serious point. Sometimes this vision loss is affected by floaters, flashes, and halos around the light. So, whenever patient comes to you in vision center when they are saying sudden loss of vision, okay, you can ask them, did they had any floaters, flashes, or halos associated with sudden loss of vision or before sudden loss of vision? So these are the common symptoms patient may notice. So let us see some of the conditions now which are associated with the pain. So if you see these conditions like acute angle closure glaucoma, so when the angle structure closed suddenly, the intraocular pressure elevates very high and patient will have sudden loss of vision because of the corneal edema, and patient will notice pain, headache, redness in the eye. The second one is acute uveitis. When the inflammation happens to the uveal tract, especially the anterior uveitis, patient will notice sudden loss of vision. The third one is ocular injury, either open globe injury or penetrating injury or clove glose injury. When injury happen to the eye, patient may notice sudden loss of vision with pain. The fourth condition is endophthalmitis. So in endophthalmitis condition, patient may notice decreasing vision in short time. This could happen after any intraocular surgery or sometimes any infection started in the eye. In couple of days, the condition become very worsen. So I just kept 3-4 conditions for example to make you people understand which are coming with pain. So now let us see some of the conditions which cause sudden loss of vision without pain. For example, retinal detachment and retinal vascular occlusion. We all know that retina has veins and artery. If any vascular occlusion happens, the retinal functioning will decrease and patient will notice blur vision or sudden loss of vision. So these are some examples like central retinal vein occlusion, branch retinal vein occlusion, and central retinal artery occlusion. So next one is vitreous hemorrhage, then wet age-related macular degeneration, and optic neuritis or damage to the optic nerve. So let me explain you these conditions little briefly one by one. If you take the first one, retinal detachment. So this usually happens in 3 types. The first one is rhegmatogenous retinal detachment. This usually happens when patient having some weak areas in the peripheral retina, like some myopia patients or some of the patients where there is a retinal tear, retinal hole, or break in the peripheral retina. Some patients will have degenerations in the peripheral retina. So these weak areas in the peripheral retina can cause detachment in the sensory retina. The second one is tractional retinal detachment. So this usually we see in the severe diabetic retinopathy conditions. When patient having diabetic retinopathy, we will notice some proliferative membrane forming between the vitreous and retinal surface. This proliferative membrane will pull the retina out. So that is called tractional. So this causes tractional retinal detachment. The third one is exudative retinal detachment. When there is some inflammation within the retina and choroid, so this inflammation causes some fluid accumulation. Some fluid will be accumulating underneath the retina. This fluid will push the retina forward and causes retinal detachment. So these are the three conditions where patient get retinal detachment, and this can cause sudden loss of vision. The second one is retinal vascular occlusions. Either vein or artery of the retina get a blockage in the blood circulation. Patient will notice sudden loss of vision. Okay, so what are the reasons for these conditions? If patient having any systemic conditions like dyslipidemia, which means abnormal cholesterol level, or raised blood pressure, and any arteries dysfunction. So our eye has blood circulation, but this circulation comes mainly from the heart. From the heart, we have carotid artery. Carotid artery has a branch of ophthalmic artery, and ophthalmic artery is supplying to the retina and other parts of the eye. So anywhere in this artery circulation, there is a dysfunction. There is a chance that the blood circulation stops to the retina, that causes arteries or vein occlusion sometimes. The other condition is vitreous hemorrhage, so which means blood into the vitreous body. Usually we see this in diabetic retinopathy conditions and sometimes some other vascular conditions also. So here patient will come to your clinic and saying that they have history of diabetes, and they will say that when I woke up in the morning, I noticed the vision is very blur. So in these people, after history and visual acuity examination, when you do the retinoscopy, you will find very dull reflex, or sometimes the retinoscopy reflex is absent. So that is giving you clue that there could be hemorrhage in the vitreous. When you do slit lamp examination, you find the whole vitreous is slightly in reddish color, or sometimes it is cloudy. When you try to take any fundus pictures also, you will get very hazy view of the retina. Sometimes you don't get view of the retina also. So this condition is vitreous hemorrhage. The next one is wet age-related macular degeneration. So this also causes sudden loss of vision in elderly age group. The reason for this is generally what happens is in the choroid level under the retina, the patient will develop new blood vessels. These blood vessels causes hemorrhage in the macular area. So that might be damaging the retinal pigmented epithelium in the macular area. So patient will have sudden loss of vision. In this condition, even if we give treatment also, the prognosis would be poor. The next condition is about optic atrophy or optic neuritis. So any damage to the optic nerve or any inflammation to the optic nerve, patient will notice sudden loss of vision. For example, Your patient will tell that my vision is decreased suddenly. If you ask them history, they may say that they are suffering with viral fever. So viral infections to the body can cause problem to the optic nerve sometimes, or any toxic conditions like patient is using some medications to the body. That medication drugs causing side effect on the optic nerve. Sometimes patient may have history of smoking and alcohol from long time. This also may cause inflammation to the optic nerve. And sometimes your patient will give history of ocular trauma or road traffic accident. When there is a serious injury to the eye or to the head, that may damage the optic nerve. Sometimes patient may have tumor in the visual pathway, means the connection between the optic nerve and the brain. In this pathway, if there is a tumor, when the tumor grows up, it might be pressing the visual pathway system, and patient will notice sudden loss of vision or field defect. And there are some systemic conditions which can cause optic nerve damage. So, for example, multiple sclerosis. I will tell you briefly about this. Any nervous system will have some cover around it, some tissue covering the nerves. In this multiple sclerosis disease, this tissue will get damaged and causes damage to the nerves. The same thing can happen to the optic nerve in case of multiple sclerosis. It is a systemic condition. Okay. So far I have discussed about conditions which are causing sudden loss of vision in the eye. So now in the couple of slides, I'm going to discuss with you briefly about how to investigate in primary eye care. Okay, how to investigate a sudden loss of vision in primary eye care. Along with your comprehensive examination from history to slit lamp and applanation tonometry, what are the tests additionally you have to perform is you may need to measure visual field. In primary eye care, I don't think you have visual field analyzer, but visual field you can measure with confrontation test. So this test will give you a gross idea of visual field defect. The second one, color vision test. The previous speakers also explained about this. Most of the times, damage to the optic nerve or retina can affect on the color vision. So the color vision test will give you clue saying that there is a problem in the retina or optic nerve. The third one is Amsler chart, which is available in our primary eye care centers. Any patient complaining field defect, you can do this Amsler chart, which will cover around 20 degrees from the center. And the last important one is RAPD test. If you have ophthalmoscope or you have good torchlight, do the pupillary examination and see the pupillary response with the torchlight. If you find any pupil is dilating, generally the pupil should constrict when you show the torchlight, but the pupil is dilating, that is the indication of RAPD positive. So RAPD positive, usually we see if there is a serious problem in the retina or optic nerve. So this is very common and simple test which will give you clue to investigate if there is a serious retinal problem or optic nerve problem. Okay. So these are the tests which are available in the primary eye care center and will help you to investigate sudden loss of vision because of ocular conditions. Okay. So these are the things I wanted to discuss in this short time, and I thank everyone for listening patiently. Thank you.